Hey, Fabio.
Hey Brandon, how's it going?
Are you reading some EEGs here? What
Yeah,
do you got?
I got a really interesting midline seizure.
Oh, we should bring in there's a hero who can help solve this case.
Oh yeah? Oh, you're talking about the Greek hero?
Yeah, do you have a picture?
Yeah.
Oh, Giannis.
I think he
No,
was
I mean, I
contemporary.
don't know if this guy reads EEGs. I was thinking of Ioannis Karakis, the superhero
Oh,
of EEGs, the greatest of all time.
I see.
Hey
Oh,
guys,
Dr. Karakis.
I heard my name. I
Geez,
have
from
to
that
say the
guy.
only thing I have in common with Ioannis Karakis is the first name, and that's it. How can I be of help?
Yeah, I don't know, because it's a pretty straightforward seizure. I don't know why we needed an expert, Dr. Westover.
It doesn't look right to me. What do you think, Giannis?
I think it's a very interesting record. We don't get to see it that frequently. Can I have some more background information about the case? Or am I
Yeah,
supposed to read completely blindly?
no, I can give you a little bit of info.
You-
So I think it's a 60-ish year old with one spell, and the EEG was normal. He became drowsy, and then this popped up.
Okay, well, I mean, like everything else, you have first to orient yourself. You're looking at an AP bipolar montage, left over right, with the midline at the bottom and the EKG. As you pointed out, this looks more like a drowsy record because you don't see a very well sustained posterior dominant rhythm, no eye blinks, no muscle artifact. But there is something very interesting in the middle of the epoch that seems to be more centrally located. So like everything else, before you conclude what it is, you need to describe it and see if it fits a normal or abnormal pattern or some sort of an artifact. So trying to describe it, we can start with the distribution. It looks that it is centrally located, more so in the CZ, PZ channel, with a spread to the parasagittal more than the temporal regions. And if you had to count its frequency, I would say that it falls more within the theta range. It is rhythmic, but it's fairly monomorphic. So in that sense, it doesn't have the clear-cut evolution that you see in terms of the amplitude, location, and the frequency that you would expect in a rectal discharge. And it's also pretty short-lasting, maybe 6-7 seconds all in all. I would be curious to know what the patient is doing during it. Do we have any idea from the video?
Yeah, I don't think he was doing anything.
just resting.
Yeah.
The other thing that would be interesting to know is whether there was any reactivity to it. So let's say we ask the patient to change the state, or we ask the patient to do a particular movement, or close and open the eyes, think of moving one of the extremities or the other. All these things could help us differentiate what exactly it may be. So putting all this together, I would say that there are a few possibilities here. One of them would be the possibility of a midline theta rhythm, which would fit all the criteria that we have already discussed. That was first described by Cigánek in the early 60s, although there were some reports of similar activity showing up in the midline in the 50s by Arellano Schwab associated with some mental activities. But Cigánek first observed this activity in 50 patients with epilepsy in the early 60s. 36% of them ended up having it, so it was thought to be associated with epilepsy. Interestingly, so temporal epilepsy, and the notion was that through the PAPES circuit, the activity would spread to the anterior cingulate, and that's why it would be higher amplitude in the midline region. Wow. Later on, of course, there were papers that debunked that, including one from Cigánek's group 10 years later. Mokran started casting doubt about it being really an epileptiform pattern. And in the mid-80s, Westmoreland and Class identified it in many non-epileptic patients, and so therefore it was concluded that it's a non-specific finding.
Was the percentage about the same, or do we know this?
So the numbers that of prevalence of this pattern, when you include all comers, comes down to single-digit numbers and close to less than 2% in Mokran's paper and 0.01% of all comers in Westmoreland's paper. So it's not as common, although I have to say that frequently we discount it as being a drowsy pattern and don't really put too much emphasis on it nowadays. So it may be a little bit more than that in real life.
I think often I don't even just pass by it and don't even comment on it, I think. So I bet that I don't know, depending on how you're doing this study, it would be hard to get an accurate prevalence, I think, if you just went by reports, for example.
It's true.
So some people try to differentiate whether this pattern is identical in everybody and what the clinical significance really is. It is sometimes arciform, the way it appears here. Sometimes it's more sinusoidal. It does wax and wane during the record, but usually it occurs in the same pattern for each individual, even if you record them on serial EEGs over time. It's more important to identify it as an entity and differentiate it from other entities, seizures for most, but also other basal cortical rhythms, such as alpha rhythm, which tends to be more posterior and reactive to eye closure, and usually in wakefulness, or mu rhythm, which is more parasagittal located, also alpha range, mostly in wakefulness, and going away with moving the opposite extremity or thinking of that action.
That's why you were asking about moving the hands, or
exactly, yes. It's such a way to differentiate other rhythmic activities that occur close to the midline or can spread to adjacent areas to figure out which one you are dealing with. By definition, this midline theta rhythm occurs mostly in the CZ electrode. Sometimes it will spread to the PZ and be more irregular in elderly patients, or to the FZ and be more regular in the younger patients. But it's not written in stone. It can spread to the parasagittal chains as it does in this situation.
What about the fact that this is in drowsiness, though? Wouldn't that kind of cross off alpha rhythm and mu rhythm for you?
That's true, but Cigánek rhythm or midline theta or third rhythm, as per some literature, can be encountered both in wakefulness and in drowsiness. So it's not an absolute criterion that you would see it in drowsiness.
So this person, if this is all the only sort of thing that catches our eye, you would read it as normal?
Yeah, I would think so. In general, we have a tendency on the EEG world to keep things low unless they repeat themselves and they really stand out from the background. But if I had a chance to re-record that patient, I would be curious to see what occurs with mental activities, because this has been also described in the context of knitting or texting. What occurs with prompting the patient to arouse or let the patient drift away, see how it reacts in various situations, and also test the patient in the middle of it and see if they can follow commands and communicate properly.
How often does this occur in one record, typically, by the way?
It's typically 4 to 20 seconds. Now, in terms of percentage of the duration of the record, I guess it varies on how long the record is, but majority of the times it doesn't exceed 20 seconds. It's not something like Shredder, for example, when it can go on for pages and have a pseudo evolution. This one usually waxes and wanes, but doesn't have any evolution.
Yeah, that looks like that we're seeing them every 30 seconds or so, I think.
Yeah, quite a few. Awesome. Cool. Okay, I'll change it to normal then.